visiting a doctor or nurse, or maybe any healthcare professional among the 12 professionals. Yes. So um, you will have to listen to the audio, and there would be certain questions. Okay, so there will be questions which will be given in your questionnaire, and you will have to listen to the audio. While listening, you will have to answer the questions which is there on the questionnaire. So basically, it is not like a question as such. I will talk about that. I will show you a sample of the part A questions. Okay, so it will be more easy for you to understand. So before that, let me tell you. So you will be having two consultations. For example, a total of 24 questions. Okay, 12 questions each for each recording or the audio, about which is 5 minutes. Okay, so 5 minutes will be played to you, and you would have to answer all 12 questions. Likewise, you have another audio for which will be played for 5 minutes, and you will have to answer the 12 questions again. So that total comprises of 24 questions in total. Okay, and see, the questions is basically like, maybe like a fill in the blanks, or maybe you will have a blank area, and during the audio you will have to identify the word or the short phrase which needs to be filled in when you're listening to that audio. Okay, so that's how you identify it. So you need to have a very good listening skill, and also definitely, yes, you will have to have concentration. You need to understand the different slangs of English. For example, as we all know, you might have heard different type of English. A person from Britain or from the UK speaks British English. Yes. A person from USA speaks American English. Yes. Person from Australia speaks Australian English. So each has, it's all English, but the tone, the speed, or maybe the slang, all differs. So he needs to understand that. So we need to get familiarized. We need to familiarize with all these type of English. Okay, so that's a key thing. So for which, so that you can understand what the person is saying, and also you can get, a good understanding about what is he talking about, and you can identify the words or the things which is there on the questionnaire. Okay, so you need to familiarize with yourself with all these different accents as well. Okay, so let's look at the the questions. Okay, so basically, and as I said, the audio would be played. Okay, this would be a type of question which you would get in part A. Okay, for example, you say the patient. The patient, you have certain things onto. Do you see the screen on the? Can you see a screen on my presentation? Are you able to see the screen here? Can you see this? Okay, so that's good. Okay, so it is like you will have a screen, or you'll have the questionnaires like this. Okay, during the audio is being played, you also need to look at this questionnaires, and you have to concentrate. It goes like this. Okay, for example, a patient is being the audio would be might be something about the patient is having a consultation with a doctor. Okay, so he would be asking a lot of questions. So for example, if you see here, patient's description of symptoms, pain located in. So maybe the doctor would ask during the audio that, could you tell me where do you locate me ear pain? Maybe a question like that. Okay, so the patient answers to it that, or yes, I do have a pain on my knee. Okay, so that would be the answer. The knee would be the answer. So this is how you. It's just an example which I just you know wanted to tell you. So this is how you would be doing your listening in part A. So in part A, all you have to do is listen to it and concentrate to the audio, and you pick up the words which is relevant, or the pick up the words or the short sentences or the short words out there, okay, and fill the blank out there. That is what you have to do. Okay, so um, I hope you understood what is all about the part A. Is that clear? Okay, I do have people saying yes, yes. Oh, that's good. Understood. Okay, that's very good. Okay, okay. So let's move on to part B then. Yeah. Okay. So the part B, um, it's a short workplace extract. For example, you will have 1 minute audios. Okay. Okay. You will have 1 minute audios, and you will be provided. You will have 6 audios played, and you will have 6 questions. Okay. For example, um, when you start with the part B, okay, you will first see the questionnaires with 6 questions. Just beneath each question, you will have multiple choices. Okay, okay. You will be allowed to read through those questions before the audio is being, started or initiated. So you can go through the questions and even the options, and one by one, the audio would be played. Okay, so the audio, uh, the purpose of sorry, the purpose of playing or the part B in listening is that you need to, it is to assess your ability to identify the details which is there, which is being told in the audio. So you need to understand the content is being what is being spoken or what is being said in that particular audio. To be precise, you need to understand the gist of the audio. Okay, maybe the questions might be something like this: what is the purpose of the speaker? And the audio would be played. The speaker might speak about something related to the healthcare. So that is something which is very beneficial to you, because when you listen to something which is of healthcare, definitely you will be able to understand it very good, right? Which is within your stream. Yes. So you listen to the audio, and as I said, we need to identify the opinion of the speaker. So by listening to the audio, meanwhile, while listening to the audio, you can also go through the multiple choice answers, or you will be given with a number of choices for that particular question. But when you're listening to the audio, you go through the options as well, the multiple choice, and from that, you select the appropriate answer. Okay, so each extract or each audio will be there for 1 minute. So you will have 1 minute to listen to the audio and to answer the question. And I would also like to remind you, the audios will be played only once. Okay, so no repetition is being done there. So you have to keep in mind. So you need to have a good process, or you need to have a good idea about the English, and you need to understand that. You need to get, that is why I said, you need to familiarize yourself with different accents and different English ways and different slangs. Okay, so that is the key thing out here. And also, so if you understand, if you are able to familiarize with these different accents and different English slangs, it is quite easy for you to do the multitasking then. Yes. So when you listen to the audio, you will be able to you can understand the gist, and the purpose of the short extract and answer. So likewise, I said, again, you'll have 6 questions, and the 6 questions will be accompanied with 6 audios, and each audio would be having 1 minute each. Okay, so is that clear? Yes, yes, yes. I do see that people very clear. Yes. If you have any questions, please pop up your questions. Absolutely fine with that. Okay. Okay. I do see. I do get a lot of yes here in the chat comments. So that's good. Okay. So let's look at a sample question in part B. So basically, each question, you will have 6 questions, as I said. Okay. So I told you in part A, you will have 24 questions. Yes, correct? So next, the part B starts with question number 25. So this is how it is. The first question is here. In part B, you will have, as I said, 6 questions, each questions with a short audio, okay, which would be played to you just once. And let's look at the question here. You hear a nurse briefing her colleague about a patient. Yes. So this is a real scenario which you would encounter in your profession. Yes. So you will have your briefing sessions after um, maybe after you relieve, okay, from your duty to your colleague. Okay. So this is what OET is saying about real scenarios. You're going to deal with real scenarios here. So this would actually help you to understand more and do your exam or your OET exams well. Okay. So the nurse is going to brief to her colleague about the patient whom she had been taking care of. Okay. So the question is, so that is the scenario there. So that is what you see on the first as a note. So the question is, what does she warn her colleague about? So when you listen to the audio, you might not be getting, she would be briefing the colleague, and you will not be having, a word which states, I would like to warn you, and things like that. Okay. So this is where your understanding is very necessary. Okay, you need to listen to the audio very carefully. You need to concentrate. You need to understand what the nurse is speaking, and you need to identify what is she warning her colleague. So you'll have 3 options there. Okay, the patient is allergic to some type of antibiotics. Care needs to be given to prevent the patient from falling. Oxygen may be needed if the patient becomes breathless. So all these things is there. Yeah, so you have 3 options, and the audio is being played. So from the audio, you need to understand, or you need to get the gist of the audio and answer the question. Okay, so here in part B, you are not actually going to look for the words which is being said by the speaker. You are trying to understand the audio and write the select the answer which has been given out choices. Okay, so this is how you do a part B. Any questions for me so far? Do you have any questions? No, no, no. Yeah, I do see that. A lot of people coming up with no. Okay. So far, so good. I believe that so far, so good it is. Okay. So let's move on to part C then. Okay. Part C. So in part C, you would be, given with two extracts or two audios. It will be long audios. Okay. And you will have to listen to the audio, and there will be two audios, as I said. Like in part A, as I spoke about in part A, you have two audios about a consultation, right? Here, same like it. You have two audios, but it is not a consultation. It might be a presentation or an interview, which is recorded. Okay, so it will be played to you, and you will have two extracts. Okay, and six multiple questions will be there for each extract. So in total, in part C, you will have 12 questions. Okay, so 6 plus 6 is 12. Okay, a very simple math, yeah. Okay, so let's look at the part C questions. So what are the type of questions which you would be getting? As I said, um, so out there, it starts with the part B started with question number 25. So you add 6 questions to it. Okay, you'll have what? Sorry, my math system wrong then. Okay, okay. So let's look at part C then. So the question is, Anna says that the main focus of her work as an occupational therapist is. Okay, so you will be given, or you will be listening to the extract. Okay, for 5 minutes. Okay, or maybe 5 minutes, or sorry, 15 minutes in total. 15 minutes extract in total, I'm saying. Okay, and you will be given with questions. That is 6 questions in each extract. Okay, you will be given time before the audio is played to go through the questions and also through the options. Okay, so you read through the questions, you have an understanding about the question, and it will be mostly in a sequence order. Okay, the questions will be in a sequence order as the speaker or the audio is being played. Okay, so you don't have to worry about that to an extent. Okay, so the questions is as the audio, when the audio starts playing, you listen to the audio. Meanwhile, oh yeah, okay. Um, could you able to? So I do have a question here in between. Could you able to play a sample audio by Trajoly? Okay, and please tell the marks for each extract. Yes, definitely yes. Okay. So let me finish with these things, then we will come back. We'll come back to that. Okay. Okay. So okay, we are talking about the extracts. So the audio is being played, and the audio will be, played. Meanwhile, you will need to look at the questions in a sequence. So you need to really, really concentrate on the audio. You need to be pretty sure you are at the right area, at the right questions, which has been pertaining to the extract. For example, a person is talking about something, and you need to be pretty sure. So that comes with experience, that definitely yes. So you need to listen to the audio in a sequential way. Okay, so you listen to the audio, you look at the first question, that in the audio they would be mentioning about the answer. Okay, here also you will not get a direct answer. Maybe at times you will not get a direct answer. Okay, you will get answers which is in a broken areas, or maybe in 2 sentences. So you need to understand or you need to understand, you need to get the answer from there. You don't have to formulate an answer. You will have multiple choices here. You'll have to select the answer from the multiple choices. Okay? Okay. So this is what you do in part C. So we had a question about, one person asking, could you able to play in a sample audio? I'm sorry that unfortunately I do not have a sample audio at this present, but definitely, we would be playing you with sample audios, and we would be taking you through this listening in detail. So this is just an introduction. So that is why I just wanted to introduce you to the different modules and different OET things. Okay. So it is just an introduction. No, you don't have to worry. We would play you with the sample audios in the later, webinars or later sessions. Okay. So yes, definitely. I'm sorry that I couldn't. I did not mention about another person who asked a question is about. Please tell the marks for each extract. Yes, definitely. Each extract, correct. Okay. So this each question carries 1 mark. For example, in part A, you will have 2 extracts. Yes, so total of 24 questions. Each carry 1 mark. All the questions carry 1 mark each. Okay, so you don't have to get confused. Okay, so basically each question is 1 mark each. So in part A, you have 12 questions. So 12 mark for the first extract, the second extract, again 12 questions. So that also totals up in part A is 24 questions. If you answer all the ones correct, you will score 24. You will get 24 marks. Okay. So in part B, again, you have 6 questions. You will score 1 mark each. In part C, again, you have 6 questions each in each extract. So you have 2 extracts in part C. So you have 6 questions each. You get 1 mark each for each question. So in total in part C, you get 12 marks. Are you clear? Do you have any questions? Okay, I hope. So I'm just looking at the chat here, and if you have any questions, please pop up the questions. Mm-hmm. Okay, so I do have a question here. What is the minimum marks to reach score B? Um, yes, that is the question. Yes, definitely. That is something which you require to, for example, okay. So you will have in total of 42 questions, as I said, in listening. So you will have to get, a minimum of 30 and above to score a B. Okay, so that happens on each module. So we will talk about that in detail later on. Okay, so what are the scores? What are the different, score levels and things like that? So in this particular, webinar, what I'm planning to share with you is just to introduce you to the different, modules here. Okay. Yes, I do have a question here. If you feel some answers look same, what to do? Okay, see, so I do have Ashika, which is who has a question. If we feel some answers look same, what to do? Okay, so that is a good question, yes, but I want to. That takes time for me to explain about it. But however, as I said, we would have you. We will be taking you through, a session for listening separately. Don't worry about it. It is just, I'm just taking you through, a quick overview. That's all. Okay. So don't worry about it. We definitely would take you through that. Then I have Liji, Susan. Any tips to crack Part C? Yeah, that is what everyone wants. That I presume these days. Yes. Okay. So to crack Part C again, as I said, as I answered earlier, we would have a detailed, listening, maybe a listening module conducted for you. Okay, so not to worry. So we have another 3 modules to go through. So that's why we are running out of time. Okay, is 30 only appropriate for getting B? So I'm just saying. No, I'm just saying approximately 30. Yeah, 30 is something which you should be aiming to get a good score or a score B. Okay, so one of the person asked, is 30 only appropriate for getting B scored? As I said, this is just an approximate score which you require. You should be aiming. Your goal should be to get at least 30. Okay. Yes, aim more than 30. That is what it's all about. Okay. So any further questions? Okay. Okay. Yeah. So I'm waiting. If anybody has any questions, please. So because with that we would move on to. Okay, I do have a question here by Juby Chaku that how can I improve listening? Yeah, that is a good question, Juby. That see, the problem with most of us is that we actually you need to, as I said in the beginning, okay, we need to understand about different accents, different slangs of English. That is something which hinders most of the people in listening. So all I can suggest you is that listen to different audios, get familiarized with different accents, different people, different modulation of speaking. Maybe a person might be, for example, an Australian might go a bit more faster, or the pace of speaking would be quite faster. So unless and until we get used to it, okay, we wouldn't be able to encounter those situations. So all I would suggest to you all to do is listen to different audios, get familiarized with different English slangs and different pronunciations, get the right pronunciations, all these things. There are different, yes, I do have another question. Sir, any podcast or website for improving listening? There are different. What I can suggest is, since we are equipped with Google, okay, all you can do is like just go, searching for maybe an audio with, BBC Health would be a good, um, option for you to listen through, which shows you about, which talks about the healthcare things. Yeah, so that would actually help you to get familiarized with the language, English. Okay. Okay. So let's then. Oh, thank you. Thank you. Welcome. You're welcome, lady. Okay. I have another question here. Is only play Australian? I do see that Grishma has a question that only Australian English is being played during the examination or not. Not precisely, Grishma. The thing is that they play different audios. Okay, they play American. They play British. They play Australian. mm, You know, different accents and different English. So it is not. It depends upon each speaker or the different person who's been talking out there. Okay. Yeah. Okay. So let's quickly move on to the reading part then. Okay. So coming to the second module, that is reading. Okay. So as I said in the beginning that OET, what is OET expecting from reading? So they're actually going to assess whether you are able to understand the English, okay, which or a text has been given to you. So you are asked to read that. From that, you will be asked several questions, okay, and you need to answer the questions with multiple choices or with different options which has been given there. So we will, as we discuss about listening, it is in reading also we have three parts. That is part A, part B, and part C. Okay, so in part A, you will have 15 minutes. Okay, so you will have 15 minutes to do the part A. This is the one thing which you need to really, um, work on when you do reading, for example. Okay, as I said, reading has part A, part B, and part C. And part A has 15 minutes. Part B has part B and C in total combined has 45 minutes. So which totals up to 60 minutes. So that is 1 hour. So your reading would be 1 hour, as in listening again 1 hour, but it's approximately 40 minutes, the audio. But in total, they say that it's 60 minutes, but the audioing itself is like 40 minutes or less. Maybe it depends upon that. Okay. Okay. So in reading part A, okay, when you are given with the questionnaires, you will be given a set of questions that is part A, and you will be only allowed 15 minutes to do that part A questionnaire. Okay. So you might be thinking, okay, for example, in most of their exams, in our school days or college days, yes, we have an option of going back. For example, if you get a questionnaire, you have different questions, yes, okay, and you go through the questions, you write the answers, but towards the end, you have a feeling that one of the questions, the answer which you've written is wrong. Okay, so you go back to that question, you correct that question. Yes, that's what we all do, right? Okay. We do have an option to do that out here as well, but the time is where we have to be very particular about your time. You need to do a very good time management in reading. Okay. So in part A, you will get a questionnaire, okay, a set of questionnaire, and you will be given 15 minutes. Okay, you need to finish those questions, or you need to answer those questions in 15 minutes. Here also, all the questions, you know, has or takes 1 mark. Okay, you will score 1 for each question if you answer that correct. Okay, okay, so you get 15 minutes, you answer the 15 questions. Later on, you will be taken, the questionnaires will be taken back, or your answer sheets will be taken back, and you will be provided with part B and C. It's like a booklet. Okay, you will be given with that. Okay, so as I said, your total reading module timing is 60 minutes. That is 1 hour. But from that 1 hour, the first 15 minutes is for part A. So once you're done with the part A, okay, you will not, and once the extract has been taken by or taken out, or the your part A booklet is taken out by the examiner, you will not be able to do any corrections on that. Okay, for example, on your 30th minute of your exam, you feel that okay, you have a question, you remember that okay, one of the question I answered in part A is wrong. I need to make a correction. Okay, you will not be able to do that because you don't have that part A booklet with you because that has been taken. Okay, so please be assured that when you do that part A, you do it right. Okay, in part B and C, it's 45 minutes. Okay, so what is it there in part A? Questions. So that is it is basically a skill which you require. You need to do a fast reading. You need to be reading very fast. I do see that some of you can't hear my voice. Could you tell me, can everyone hear my voice? Is it clear? Oh, yes. I do see that Rosmol is having some difficulty in hearing. Rosmol, I think you need to check with your audio. Okay? Okay. So let's come back to the part A. Yes. So all you have to do is a fast reading or an expeditious reading. All you have to do is basically the skill which you'd be using in that particular or in part A is skim and scanning. So normally what you do, we all read newspapers, right? Everybody does read newspapers. Nowadays, the reading newspapers have become very common, I think, because we are all eager to know the news with regards to what's happening around us, especially with the virus which has been affected around the world. Yes, so we are all eager to read the news. So what we all do normally when we get a newspaper, we quickly go through the headings, right? Yes, we just quickly go through the headings. So that is called skimming and scanning. So we might not go through the entire content in a news or in a newspaper unless and until we feel that it's quite interesting to us. Correct? So we just, first what we do is like we just quickly read the heading or maybe quickly go through the extract here and there. We just read the contents here and there so we could understand whether this is good or not. Okay, that is what we do. So that is what you require in this part A. So that is a skill that is called the skimming and scanning. Okay, that is what you're going to do in part A. So let's look at the type of questions which you would be getting in part A. You'll be given, you will have in part A. So here we don't have any audios, it's reading. Okay, so this is your reading test. You'll have 20 questions and you will have 4 texts. Okay, you'll be given with 20 questions and also 4 texts. From the 4 texts, okay, you need to quickly go through the text. So you have to do a fast reading, identify the text. Okay, I'm sorry about it. Okay, you need to identify the text and answer to the question. For example, let's look at the first question: procedures for delivering pain relief. For example, you will be having, as I said, 4 texts. Okay, maybe something related to a disease. Okay, so it'll be the first text might be an introduction about the disease. The second text would be about the diagnosis, how you could diagnose the the disease. The third text would be what are the medications which could be used for this disease, okay, or for this particular case. The fourth would be what are the managements which a nurse or a doctor could do for this. So there might be 4 different texts. I'm just giving an example. So it might be not the same, it might be different. Okay, so just a quick example. So from this, you need to identify you need to quickly identify, okay, the content, the answers. For example, here it says questions 1 to 7. Decide which text, A, B, C, or D. So basically, you'll have, as I said, 4 texts. So it will be named as A, B, C, and D. Okay. So the information to these questions will be there in any of these texts. Okay. So you need to identify these you need to identify the answer pertaining to which text. Okay, and write the answer there. For example, from 1 to 7, you have to just write as A, B, C, or D. So uh, which where can you find the answer of this particular question? That is what you need to write here. For example, where can you identify the answer to the question? In which text? Okay, so that is what you will be saying. For example, procedure for delivering pain relief. That is a question. So where can you get this answer? Where can you get this answer? From which text? Is it A, B, C, or D? Okay, so this is what you have to do when you answer part A, 1 to 7 questions. Okay, likewise. Okay, so if there, okay, I do have a question popped up on the chat. If they described more than 2 procedures, how to select the correct one? Okay, so if they describe more than 2 procedures, yeah, that depends upon Shibi. That depends upon the question. Okay, so you need to identify the questions correctly. There will be, as you said, there might be 2 procedures. How do we select the right one? So they will be always pertaining to a particular question. Okay, the question will be very clear. So this is how this is where your reading part comes into play here. You need to have a very good understanding of English. You need to read them. You need to understand that. That is what is being assessed in reading modules by OET. Okay. So as I said, in detail into how to select the correct or how to read and understand the questions correctly, that we will be discussed in a separate reading module. Okay, is that clear? Shibi, is that okay? Okay. Okay, that's good. So yes. So okay. And in part A, it is actually divided into part A is actually divided into 3. Basically, as I said, you have to the first 7 questions is to identify where the answers are in which text are they. So you have to just answer whether it's A, B, C, or D. Okay, the next questions that is from 8. Okay, from 8 to the next 20 questions. So it's a total of 20 questions, I said, right? So the other 20 questions is all about, a short word or a short phrase or a few sentences or a sentence, a short sentence. Okay, from the extract, you need to read the extract or the text or all the 4 text. So you don't have to basically completely read. Okay, so by reading the question, you need to first do is you need to identify where can you find the answer of this question in which text. Okay, so after identifying that, you go to that text, you read the text, refer to the question, get the answer, and write the the short phrase or the short sentence there. So that is what you'll be doing in part A. So part A, this has to be done in 15 minutes. So you need to do a good time management. Maybe when you start with reading, you might not be able to, but with practice and with more practice and more practice, you would get hold of the time management. Okay, and we will discuss about that when we get into the reading modules in details. Okay, so I hope you are quite clear with part A. Any questions? No. Okay, I do see no questions. Okay, so can we move further to part B of reading? Okay, okay. So let's quickly go to part B. Part B of reading. So this is where. So when part B starts, you will be given with part B and C together. That's um, you know that is a text which has been given. Okay, once the part A is done, so that is 15 minutes over. That particular text or that is being taken by the examiner, and you'll be given with another text which includes part B and C. In part B, like in listening, you will have 6 questions. Okay, but here in listening, what you had is a short audio, right? Likewise, in in reading, it's just a short text. Okay, and you will have 6 questions, and all the 6 questions will be having 6 short texts. Okay, you will need to read the text, get back to the question which is there. You will see question number 1, read the question, and you will be given with answers A, B, and C. After reading the text, okay, you need to answer the questions, the right question, the right answer. You need to pick the right answer. Okay, so again here you will have to do time management. You will not get the entire time to do it. Okay, so basically you will get precisely 2 minutes to do each question. Okay, so each question will be provided, when you do the maths, you get 2 minutes to read the extract or the text and answer the question for each question. So all the 6 questions, it's 2 minutes each for that. Okay, in listening, it was the audio has been played, right? Out here, you have to make sure that you do a very good time management when you're doing your reading. Okay, so this is what's all about reading. So in detail about part B reading, how to do and how to use what skills needs to be used in part B reading. We'll be discussing that in a separate video or a webinar about reading. Okay. So do you have any questions pertaining to part B? Okay. So we'll move to part C. Like in listening, as I just said, part C also has 2 extracts. Okay, and 2 extracts will be there, and you would be given, as I said, there will be 2 extracts, and 2 extracts will be given with multiple choice questions. For example, extract 1, it will be a very long text with paragraphs. Approximately each text or each extract would have 5 to 6 paragraphs. Okay, and you will have a total of 8 questions. Okay, for each extract. So that totals to, so 2 extracts, 8 plus 8 is 16. So you will get 16 questions in part C as 2 extracts, 2 texts. Okay, so this is one of the sample which you would see when you do a part C. So you will be even with 2 text like this, and it will be explaining about maybe maybe a person's it will be an extract taken from a book written by a healthcare professional, or maybe a doctor, or maybe a scientist. something related to the healthcare. Okay, so it will be explaining about something, and you will be asked with questions. Okay, here also you will have to you will have, okay, you don't have to, first you need to read it, okay, uh, to how to apply the skills. We will talk about that later. So I'm just telling you what you would be seeing in part C. In part C, as I said, you'll be having an extract, okay, with 5 to 6. You'll be having 2 extracts, having 5 to 6 paragraphs in each extract, and you'll be having 8 questions. And you will have to read the questions. Again, here also you will be having 4 options to choose from. Okay, so you will be having a doubt that, okay, within a short span of time, how am I going to read the entire text and answer the 8 questions? Okay, here, if you see one of the questions here in question number 7, in the first paragraph, the writer uses Ivan Cartier words too. Okay, so actually the question would specify where you need to look. It specifies here to look at the first paragraph. Okay, so you need to read the first paragraph, understand the paragraph. Okay, then look at the options, identify the right answer, and mark. That's all. Okay, here also each question is with 1 mark. So there is no change to that. For the entire listening and speaking, each question carries 1 mark each. Okay, so nothing to worry about. Okay, so again, the second question, what do we learn about sleep in the second paragraph? Again, the second question is about the second paragraph in the first extract or the second extract. So you get an idea, or you would be given with some sort of clues where to look at and to get the answers. Okay, this is what you would be doing when you are doing the part C. Okay, likewise, you will have, the second extract, the same thing. Okay, and the same questions. It will be directed like that. Okay, we will talk about the different type of questions and different type of skills and different types of ways of doing reading, in part C and things like that in a different video. So, do we have any questions with regards to part C? Any questions, anyone? No. Go ahead. Yes. Okay. So with that, we end part reading. So we have completed listening and reading. I've just introduced you with listening and OET reading and listening. So our next module is speaking. Okay. So what is speaking? What is OET expecting? Or what is OET assessing from speaking? Okay. So you all have, as I said earlier in the beginning, you'll have a dream. You all will be having a dream, yes? Going abroad and working in an English-speaking country or a different country, yes? And we all see that in most of the countries, whether it's an English-speaking or not, yes, most of them, when, they use English to communicate. Yes. For example, a tourist comes to Kerala. Okay, he does not speak Malayalam, right? A tourist, maybe, for example, a tourist, let's say, an overseas person or an English person. So they don't know the local language here. So the most common thing is they speak in English. For example, a person from Paris, France, okay, comes to India. Okay, if he speaks in French, we might not even understand, correct? But it's quite easy for us to understand English and to answer. Not very clearly, maybe. At least a person would be able to reply to it. So English is something, wherever you go, anywhere in the world, English is something which has been spoken, very common. Yeah. So that is why we English speaking is very necessary. And okay, in an English speaking country, definitely yes, you need to speak in English. Otherwise, you will not be able to communicate well. So this is why OET is assessing your English speaking. Yes, to an extent, most of them would be able to speak English, but are you able to speak English in a professional way, which is required in a healthcare environment? That is what OET is assessing you by conducting this test. Okay, so they would be assessing you on the basis of whether you are speaking good, are you using professionalism, are you having a good vocabulary, are you able to make the other person understand what you're saying, are you able to understand the other person whom you are speaking with, and also uh, are you able to understand his emotions and things like that. Okay, in the perspective of a healthcare environment. So why? Okay, talking about speaking. So approximately, a speaking takes 20 minutes. Okay, your speaking test is face to face. So you would be you as a candidate, and there is an examiner, which is termed to be as another person in real. Okay, he would be sitting in front of you in a closed room, and they would be taking. You'll be given with a scenario, so you will have to do a role play. So you will be given with the scenario. You'll have to act basically. So that is what you will be doing in your speaking. See, the scenarios which would be given to you would be specific to your profession or the healthcare profession based on typical workplace situation. For example, um, a situation in a hospital. Okay, a patient is coming to you, or a patient is there in the ward, and you let's take a nurse and the patient. So, an example. Okay, so you as a nurse, the healthcare professionals always be the healthcare professional. For example, if you are a nurse, you will be doing your mock session as a nurse. If you're a doctor, definitely you will be, acting as a doctor, and as different professions. For example, let's take a nurse. You go to a ward, you would see a patient there. You will ask questions, or you would interact with the patient as a nurse. So this is what they are looking at. So this is a scenario which will be given to you in a typical workplace situation. Okay, so you will be you will be taken to a private room. So how does this exam been conducted? You'll be taken to a private room, okay, and you will have to do two role plays. So two scenarios will be given one by one, okay, uh, and you will be taking the lead of a healthcare professional, while the interlocutor, or in terms we call the examiner, or not the examiner, I would say the person who is sitting in front of you, or who would be acting, mm, uh, or to help you with your speaking, uh, that person has been termed as interlocutor. He plays the patient, and you would be playing the role of a doctor or a nurse or a dentist, a pharmacist, or whatever it is. Okay, so pertaining to your to your profession. Okay, so it could be the interlocutor could play a role of a client, maybe a patient, maybe a relative, or a carer. For example, a person who is um, accompanying the patient, okay, the carer. Yes. So all these things can happen. So what are they going to assess? in speaking. Okay, see, generally, speaking when and this speaking, when you're doing your speaking, that will be recorded in a, a tape or maybe a recorder. A recorder will be placed, and you need to make sure that you speak quite loud and clear, so the recording equipment records your voice very clearly. Okay, and this has been taken by OET, and they listen to it and they assess your language or your speaking skills. So in speaking skills, basically, they will assess different things. I will talk about that on the coming slides, which you will be having. Okay, so it will be a face-to-face, uh, test. On the test day, actually, you will be having an interlocutor place who would be in front of you. He would brief you about what it's all about. He or she would provide you with two role play cards, one by one. So the first role play card will be given to you, and you would be you will be given some time to prepare, to look at the role play card, and you need to you will be asked to perform some tasks, or you would be asked to ask some questions in that. So that we will get into detail by looking into different role play cards to coming up. Okay, so basically you'll be given with two role play cards. Okay, so how does the speaking test start? Okay, there will be a warm-up conversation. The warm-up conversation, it is actually not assessed. From the time when you sit in front of the interlocutor, okay, you would be recording would be started. Okay, you will be speaking, and whatever you are speaking, as well as the interlocutor speaking, is been recorded out there. Okay, so in the beginning, the interlocutor would start off with some warm-up questions, maybe a question like introduce yourself and things like that. So there is nothing to be worried about. It is just to make you calm down. Definitely, when you go for an examination or a test, we all will be nervous, right? Okay, this warm-up conversation would actually help you to, get comfortable with that situation. Okay, so that is not assessed. Okay, and role play one, and as I said, there will be two role play cards which will be provided to you. So before the role play would be starting, the role play card would be given to you, and you would be given with a certain time. And after going through the role play card, you would be asked to start with the role play. That is role play number one. That will be assessed. And also, after you finish with the role play card one, you will be starting with role play card two. Again, that also would be assessed. Okay, these are the two things which has been assessed as part of your speaking by OET. Okay, so let's look at the role play format. Okay, what is it looking at? So you're all a healthcare professional, right? So are we able to perform our duties in a professional manner? Yes. When you're doing in our when you're doing our work, yes, we would be. You are all doing I believe that you all do things in a professional way. But when you're speaking, are we speaking in a professional way? That is a question which needs to be asked to ourselves. Okay, so when a different language is being asked to you, or for example, if you are using a different language which is not your mother tongue, or might not be your the language which you don't use frequently, it will be quite difficult for us to be a bit professional, right? So we need to actually train ourselves to be professional when speaking in English. Okay, so in this speaking assessment, as I said, they'll be assessing the real life elements. Okay, also. And when you're doing the speaking, there also would be some situations where you get tense, because in real life scenarios, when a patient comes to you and patient argues to you about something, you'd get tense, right? The same situation would appear in the speaking test as well. So you need to be prepared to deal with that as well in a professional way. Okay. Okay. So let's look at. Okay. So what are the advantages of doing OET? Okay, in speaking terms, when you do a role play based on a typical work situation, it will be easy for you. You will feel more confident because you know what happens in these scenarios. What you would have done when you encounter with a patient, or when you encounter with a patient's carer. Okay, so all these things you are familiar with. All you have to do is make that situation and do your speaking in English. Most of the times, as a nurse or a doctor, you do your speaking in terms of your local language. You do it in your local language or regional language, whichever is demanded. Okay, but here, okay, you have to do it in English. That's the only difference. But the advantages here is you would be doing a typical workplace situation, which would be really, really helpful. Okay, which would also provide you more confidence in doing your speaking. Okay, all you have to do is improvise on your language skills in speaking. Okay, so maybe let's look at what are the criteria which is being assessed when you do your speaking. Okay, so there are two criteria. That is the first one is a linguistic criteria, and another one is clinical communication criteria. These are the two criteria that OET is assessing when you are doing your speaking. So basically about um, let's look at the linguistic criteria. That the first one is intelligibility. So what is intelligibility? So that is all about whether when you're speaking in English, or when you're doing your speaking, are you able to, are you, or the way you speak, okay, is that understood, or is it quite easy to for the other person to understand? Okay, are you making your speaking? Uh, are you doing your speaking so that the other person who is listening to you, is he able to understand what you're saying? So that is one criteria which OET is looking at when you're doing your speaking. And you need to have clarity in your speaking. Yes, you need to provide what you're saying is needs to be very clear. In the first sentence itself, the other person needs to understand. When normally, as we are quite familiar with our regional language speaking. For example, we are all, most of you are. I think all of you have, whoever is listening to me right now, is um, you know would be having, you'll be speaking Malayalam, right? Most of you would be doing Malayalam speaking. Yes, yes. So we are quite confident in that, right? So whenever we say something, okay, the other person, we are very sure that the other person understands that us very clearly, correct? Yeah. So likewise, when you do your speaking, okay, in English, the other person needs to understand. That is one of the criteria that OET is looking at. Okay, so you need to be very clear. Your English should be professional. You should have clarity in your speaking. Your voice should be clear so that the other person understands you very clearly. Okay, then you should have a fluency. Okay, the second criteria in linguistic is fluency. So what do you mean by fluency, basically? So the fluency is about not. It is not about it's all about saying, when you're doing your speaking, you need to give a clear picture of what you're saying. For example, there shouldn't be any abstractions. You should not be thinking about, you should not be taking more time or a longer duration to frame a sentence or frame or say something, okay? Or you should not be thinking, you should not be taking a longer time to express your ideas. That is all about fluency. So when a person is speaking, if you don't have sufficient fluency, definitely the problem is that the the person who is listening to you would find it very difficult to understand. Yes, correct. So the fluency is basically, as I said, based on, you need to be there should be a flow, a free flow of while your communication. When you do, as we do in our, you know, in your when we do our speaking in our local language, we don't have any issue with fluency, right? We go in a flow. Okay, we don't know, we don't even think about the next sentence or the next word needs to be uttered, correct? So likewise, again, you know, fluency is one of the things which is being assessed by OET. The third criteria in linguistic is appropriateness of language. Yes, the usage of language, you need to be very professional. You shouldn't be rude, or you shouldn't be you should be using a good language. For example, let's say you shouldn't be judgmental. Some of the things which I would like to say. For example, you shouldn't be giving an order. So those are some of the things which you should be looking at when you are speaking. So this is one of the criteria which they would be, OET is looking at. Okay, appropriateness, using the right words at the right time, and the right sentences, okay, at the right time. Okay, this is what they meant to say about appropriateness of language. Then the fourth one comes with the resources of grammar and expression. Yes, when you're speaking, you need to use the appropriate grammar and expressions. Okay, you need to have the usage of right tenses. Instead of present tense, you shouldn't be using past tense. Instead of past tense, you shouldn't be using present tense. A simple example I would like to say. Okay, and using of different expressions. Okay, whether a word which you are taking about, whether it's pertaining to present or past, you should use it correctly. So that is another criteria which OET is looking at. Okay, with regards to the linguistic criteria. Okay, these things needs to be focused on. Then moving on to the clinical communication criteria. The first one is relationship building. So what is relationship building? What does that criteria mean? So definitely you all would be confused about that. So basically having a rapport between the person, another person whom you are speaking with, or making the person comfortable to speak with you. Okay, that is what a relationship building is, or trying to make the person open about whatever his concern is. For example, when you go to a stranger, definitely you all would feel a bit of hindrance to speak about what you really want to say. For example, if you have a concern, okay, and if you go to another person and you sit in front of that person and you wanted to say, but you're hindered with the problem of scariness or something as such. Okay, but what if he makes you feel that you are very open, or the other person is very open to you? Okay, so that is what is all about relationship building. So you need to build a type of rapport between the person whom you're speaking with. So that is one of the criteria, so that you can explore more information from him, and he or she would be able to provide you with more information. Okay, so to make the rapport building is just simple that you're making the other person very comfortable about his openness to you. Okay, okay. The second criteria in clinical communication is understanding and incorporating the patient's perspective. Okay, see, when you say about understanding and incorporating the patient's perspective, you need to actually understand from the lines or the words when a patient or a person whom you are speaking to, or when a person is speaking to you, you need to actually understand from his words what his emotional feelings are. For example, a person says like this: I'm pretty much worried about my situation here. So you should understand from his words that he is very concerned about something. Yes? Okay? And you should actually react with that. So it is just not that you have that understanding in you, you have to put that in words. Okay, I really understand for that situation like that. For example, I'm very much concerned about my situation here today. So to reply to that, okay, I really understand that you are in a difficult situation, but is there anything that I can help you with? So this is all the way, rather than keeping into your mind, you're expressing that understanding in words. Okay, this is what you should be doing. Okay, this is one of the criteria which again OET is looking at a clinical communication in understanding and incorporating patient's perspective. Okay, so basically you need to make the patient more of you need to understand him from his words, and that you need to deliver that through your words to the other person. Okay, and also providing structure. So what do you mean by providing structure? I don't know if you would have noticed during this webinar. Okay, in the beginning I said that what are the things I'm going to take you through? Yes. What are the things I'm going to talk about? So I was just actually providing a structure about what is going to happen today in this webinar. Yes. So that is one of the a quick example which I could say about providing structure. For example, if you're speaking to someone and he has a lot of concerns, okay, he has a number of concerns, or maybe one concern, which can be broken down into different things. Okay, so you're going to tell him that, okay, you're going to organize, or you're going to form a structure. You're going to tell that we will be talking about this, and this. So the person who is listening to it, to you, would understand, okay, these are the things which he is going to talk to me. Likewise, by doing this, you're actually providing a structure. So this is one thing which which OET is going to assess you with. And the third one in clinical communication criteria is information gathering. So how do you gather information? Do you gather information by asking questions, or it could be different type of questions. It could be direct questions or indirect questions. What is a direct question and indirect questions? We would talk about that in our speaking module in detail. Okay, so you need to ask relevant questions, not for the purpose of asking questions. You ask questions, but you ask questions related to your task or related to that particular scenario, and it has to be relevant questions. Okay, and information. The fifth one is information giving. So whatever information you give, it needs to be precise. Okay, and you need to provide this information in a very good manner for that the other person understands it. You shouldn't be, whatever concern the person has, or the patient or the whoever is sitting in front of you has, you need to actually give an information to his consent. Maybe you might not be able to give an answer to all his questions, but you should at least acknowledge him by giving some sort of information. Yeah. So these are the criteria which OET is going to assess you with regards to your speaking. So okay, I do have a pop-up of question here. Is it with regards to is it needed to tell my name and introduce myself in hospital admitted role play, or can I directly ask questions? Um, I do see that Anita Jacob has, pop up this question here. So what I would like to say is that yes, it depends upon each scenario. Okay, so we can't really say that yes, we have to reintroduce you, but maybe a quick introduction would do. That is always good because that is a part of a culture. Okay, in an English-speaking country, you go to anyone, that is it is like a culture that, or it's like a tradition that whomever you're speaking to, okay, unless if it's a first-time person or you know the person, but still, it is good that you introduce to him. Okay, so it is very necessary that I would say that it is quite necessary that you need to put in your name and introduce yourself, even in an hospital admitted role for or any case. Okay, to make sure that you are the person there. So again, that depends upon the and the scenarios. Okay, so I hope I have answered to your question, Anita. Okay, so I would like to quickly just show you a sample of a speaking role play card. Uh, yes, Grishma, I'll get back to your question. So before that, let me just quickly, show you this sample role play card. So this is how a sample role play card would be all about. In speaking, let me tell you, speaking is, uh, you know, it is actually different from each profession. For example, the role play card, which a doctor a doctor would be getting is different a nurse than a nurse or a pharmacist or a dentist or whoever. So um, each ones for each professionals that all the 12 professionals will be getting a different speaking role play card. Okay, this will not be the same, and it will be pertaining to your profession. That would be sure, and it is a real life scenario. For example, so setting, it's a hospital setting. So this is how it is. A nurse. So this is the role play card which you will be having. So you will be having only this much. Your patient is a 55-year-old man who has come with a cough. So this is something which you get, and the bullet points which you see there, the 4 points, that is a task which you need to perform. Okay, and you will be provided with 5 minutes to do your speaking pertaining to your role play card or pertaining to your scenario. Okay. Likewise, you will get 2 role play cards. Is that clear? Okay. So the first task is take the patient's history. So when you say that take the patient's history, you might have to ask a lot of questions. Okay. Before you get directly into the into the patient's history, it's always good that you have a rapport building made up, or a quick make the patient comfortable to talk to you about it. So let me ask you a quick question. For example, you go to a person and you straight away ask, where do you come from? He would feel quite strange, right? He would feel that why he is asking me that question. So before you ask that question to another person, I think you need to ask, you need to say that maybe you should actually introduce yourself. Then you should ask questions. What's your name? Try to make the other person comfortable. Then go with your questions. Is that right? This is how you do your speaking. So this is how you do your conversation, and it has to be very much professional as well. Okay, in terms of healthcare and beyond. Okay, so the first task was take the patient's history, inform the patient about of your diagnosis. So, what is your diagnosis from the questions which you have asked and the answers which you have got from the patient. Ask him about his lifestyle and routines to ask more questions about him. Give advice on quit smoking. So maybe in the diagnosis, you have found that, okay, this the problem is that he is a chain smoker or something else. So you need to give him some sort of an advice with regards to quit smoking. So this is what it's all about. So this is what you have to do, and this has to be done in 5 minutes. I think it is more than enough time for you to do a speaking. Okay, so by doing different role plays by yourself or along with another person, definitely you will get an experience of it, and you would be able to perform a good speaking. Okay, so okay, let's get back to some of the questions which some of you have asked me. Is it mandatory to ask the name of the patient? What I would say is that if you are being provided with the name of the patient, you don't really have to. You can call by the name of the patient. You can even start calling the patient with the name. Definitely, for example, you are a nurse and you are going to meet a person in a ward. Definitely, you will be having information of the patient right in your chart. So definitely, you can call the patient, or you can even ask, "Am I speaking to so and so?" So we're just confirming with the patient that you are at the right place. Okay. I hope, Grishma, your question has been answered. Okay. And I have Anjana, Michael, how to introduce myself in an emergency situation. What I would really say is that it is not really emergency. It depends upon the situation again. Okay. So somehow it is not very necessary that you introduce yourself in the beginning itself, in the first 2-3 words or 2-3 sentences. You could do your introduction in between as well. For example, if there is a situation where you have to take an emergency situation, for example, a person comes with a wound and it has to be taken care with great emergency, you go with that. While you're doing your examination, you may introduce yourself. But I would really recommend that it's always better that you introduce in the beginning itself. That makes the patient more of comfortable whom you are dealing with. So that actually gives some sort of patient a relief. Okay, I hope, Anjana, you got the answer to your question. Okay, so anybody has any questions with regards to speaking? Okay, so with that, can we move on to the writing module? Okay, so what is OET looking at by mm, conducting tests for writing? Okay, so we all are good in English, okay, but when we do our writing, okay, we need to use the proper grammar or maybe professionalism in writing. All these things needs to be. So I have a quick sample of a task or a case note, okay, for a writing. Okay, this is how the writing question would look like. Okay, so it is just half of it. I'll just scroll down to the next ones as well, the full page. So there is it will be like in an A4 size page. So it states that Mr. Lionel Ramamurthy, a 63-year-old, is a patient in a medical ward of which you are a charge nurse. Okay, so it will provide you with who you are and what you have to do. For example, this is a letter writing to um, to a nurse, for a nurse to perform the writing. Likewise, you will have different uh, case notes or different letters for doctors, pharmacists, so and for different professionals. So, except for listening and reading, okay, listening and reading will be common for all the 12 professionals. Okay, there will not be any change for listening and reading. The only change would happen depending upon your profession in speaking and writing. Okay, so this is just a quick view of the questions which uh, you will be having for your writing. Okay, so you can take a few minutes to go through the writing thing. Okay, meanwhile, I think I missed one of the questions which with regards to speaking. Is the role play card related to one another? So definitely not. The role play card will be different. So accidentally, there could be a coincidence at times when you get two role play cards. Yes, it could, but it would not be. It will be two different scenarios. Okay, so let me just quickly go to the next slide. So this is the rest of the writing. So, in this writing, you will have the admission date, discharge date of the patient, the diagnosis, details, past medical history. If the patient is having any past medical history, all these details will be not written, in a full sentence, but in short forms or short sentence of words. Okay, and with some abbreviations and also some sort of signs uh, which it is very common so that you could understand in medical terms, I would say. Okay, then something about social background, about the patient's social history, for example, who is he, what is he doing, and all these things, which is related to the patient. Then medical background, if he is having any sort of, apart from the current problems, is he having any previous things, and like all these information will be provided. Again, as I said, it will not be given completely. So you need to go through this and understand from these short things, and you need to convert that into sentences. Okay, we'll talk about that later, one by one. Okay, so this is a sample of a a letter writing. For example, a sample letter, which it is an OET sample letter, I would say, and this is how a letter writing should look alike. Okay, you'll be having the address of the reader whom you're writing to on the left hand corner on the top. Okay, then you have the date when you're writing the letter. Then you would have whom you're addressing to, and you need to have a reference, something like a subject when you write a normal letter. Okay, then you have to introduce the patient to whom you're writing and things like that. Okay, this is how a letter looks like. Okay, so I'll just take you through the rest of the letter as well. So, and the letter should not exceed more than 180 to 200 words. Okay, when you're asked to write a letter, you should not, according to, and the OET states that your letter should not exceed more than 180 to 200 words. And they would assess your letter based on that, whether the information is being transferred correctly or not. If you have taken, if you understood the information on the case notes correctly or not. So this is how it is. So just quickly, let us quickly look at, what are the criteria that OET is looking at, okay, during the assessment when you're writing a letter. So there are basically 6 assessment criteria. The first one is the purpose, okay. So the purpose is nothing that when you're writing a letter, you need to inform the reader that why are you writing this letter, okay. Why are you writing this letter to him, okay. And in by writing that, you are apparently giving the information or the reader that the information about, or a quick introduction about the patient or whatever it is, okay. And whatever content or the purpose which you write in the purpose, for example, when you write a purpose as maybe as a first paragraph, okay, the purpose is always written as a first paragraph. So you are going to tell that why are you writing this letter to that particular person, okay, and what is that you require. Yeah. So okay. So this is what are you going to write, and whatever you're going to write later will be an expansion of what you have said or written in the purpose. Okay, so the purpose is why are you writing this letter to the reader? That should be the purpose. Okay. Yes, I do have a quick pop-up here. Grishma has asked, please tell us about these signal markings in writing. I would definitely tell you that. First we would, let me introduce you to the assessment criteria of writing, then we would come to the marking section. Yes? Okay. This is the purpose, okay? So I hope that you are okay. I think when it comes to letter writing, there are a lot of people who would like to have a lot of questions put on. But I would answer to you, but let me quickly go through the criteria first. Let me introduce the criteria to you. So later we will have a discussion on that. Okay. Okay. Then the next one is the content. Okay. So in the case note, you would not be you will be given with a lot of content. Okay, and you need to choose the relevant content pertaining to the reader. For example, you would be given, you would be asked to write a letter, maybe to a dentist. Okay, let's take a dentist. So something related to dentist is what you have to write, right? So when you select the contents should be that, which is informal or informative to the reader. So you need to select content. There would be a lot of content, or there will be a lot of information in the case notes or in the question, but you don't have to completely take that. You'll only have to take the relevant content which is adequate or which is accurate for the reader. Okay, so that also determines, or that also is one of the criteria. So if you take the irrelevant content, yes, you might lose a mark, or if you don't take the relevant content, you could lose your marks or scores. Okay, so content selection is it is very important. That is one of the criteria which OET is going to assess you in writing. The third one is conciseness and clarity. See whether unnecessary information is omitted so that the letter is effective summary for the reading. For example, maybe you would have in a letter you would have a lot of content, okay? But OET states that you need to write the letter in 180 to 200 words, correct? So when you're trying to form sentences, you know, further, and all, the letter can go beyond 200 words. Okay, so we need to concise. We need to bring that down. We need to concise. We need to make it shorter. We need to be precise with the details without losing the clarity what you want to say. Okay, so when you say that, we need to shorten it, but you should not lose the clarity. Whatever you want to say to the reader needs to be clear. It should not be half broken. It has to be very clear. Okay, and you need to, you know, give a conciseness, and you should give a clarity to the reader. Okay, so this is about conciseness. Okay, I do have a question popped up here by Krishna, that whether the purpose is needed to write in the starting section. See, the thing is that that depends upon, again. Yes, the purpose is something which he needs to write. I would say yes. You need to write the purpose in the beginning. But there are different ways of writing purpose. There is direct way of writing purpose and indirect way of writing purpose. That would be taken through when we have a writing, you know, module class or webinar, okay, in particular. So basically, we are also running out of time, so we need to quickly wrap up as well. So, but I don't want to miss on that, okay? Okay, let's look at the fourth criteria, that is genre and style. Okay, what is genre and style? So whether the register, the tone, or use abbreviations are appropriate for the reader. For example, you, as being a medical, you know, being you are in a, you know, into a medical department or a field, or the writer, you will be using a lot of abbreviations. Yes, so depending upon each reader, you need to use the abbreviations correctly, and also the tone. You shouldn't be putting, even when you're writing, you shouldn't be writing that in an awkward tone. For example, you should not be placing things like an order. Okay, so you need to use politeness. You need to use a good tone for the reader to understand very clearly, and also you need to use a good register. Okay, so you need to be professional as well. So genre and style is what which determines about this. Okay, so how you present things professionally, and the usage of you know, the tone and abbreviations depending upon each reader. Okay, you'll be writing a letter to a doctor. It will not be the same as you write to you know, a nurse. It will be totally different, right? So you use different styles, and you use a different register and styles when you are writing a letter to different readers. So that also is being assessed by OET. Then the fifth one is organization and layout. Yes, for a letter to look neat and clear, an organization needs to be in place. See, the thing is, to give a quick example, like, okay, when you write a letter, you need to place it in organization. For example, when you are going to talk about the patient, okay, or his current situation, you talk about only the current situation. Okay, don't talk about his past history until and unless it is very necessary. So organization and layout, again, depends upon the reader who is reading. Okay, for example, you need to place each content in each paragraph, so the reader has a better understanding of what you're going to say. And also, sometimes you will have to use the chronological order of the events which has happened. Okay, so certain times certain things needs to be placed on in an order, and the if you're not organized, definitely you will lose your mark on that. So the OET also assesses the organization and layout. So that is why you need to have paragraphs, you need to have contents placed in an order so that the reader understands it very well. So that also has been assessed like that. Okay. Okay, then we have the sixth one, that is language. Here it has been taken into purpose that um, when you say language, how it's been assessed is like your spelling, the right spelling, the the usage of punctuation marks when you communicate. Okay, like commas, full stops, apostrophes, all these things comes into place, and even vocabulary. Okay, so when you're writing, so what do you say about when you say about vocabulary, not using the difficult words or the words which is not common to you. No, it's not about that. When you say about vocabulary, it's all about the similar words. For example, on your content or on your case notes, you would have certain sentence or words. Maximum try to use similar words. Okay, so that is what OET is looking at. If you're able to use, if you have a good, you know, a good thing about the vocabulary, if you have a good control over the vocabulary, and also definitely yes, the grammar. You know, the grammatical part is very important. That you have to put in. All these six elements or the criteria is being assessed when you're doing your writing. So other than that, coming into a detailed one about writing, we would have a writing session separately, prepared for you, or we would have a webinar created for you. Okay. So till now, do you have any questions for me? Any questions? Okay, I do have a quick question here coming up. How to write letter effectively? Yes. If you want to write a letter effectively, you have to basically, follow all the six criteria, which is been, we have what we have mentioned today, what I have mentioned today. If you're able to meet all the criteria, you can definitely write an effective letter. To be very precise, okay, you need to understand all these criteria very clearly. So having an understanding of these criteria the first thing which you need to do is you need to have a very clear idea about these criteria. After that, yes, you can start writing. So then you will find where are your problems, and you would be able to make your corrections. I hope you got the answer to it. From where can we get practice materials? Yes, it will be provided to you from IRS, for which you can contact IRS on the number, which is, if you would like, I could verbalize the number. That is 9020 200 500. You may contact on this number, and you may inquire about the details. I have a few more questions coming. How to collect relevant information during letter writing? Okay, how to collect relevant information during letter writing is by understanding the reader whom you're writing to. So to write a letter correctly, all you have to do is, or picking up the right content is to, you know the reader whom you're writing to. First, you need to understand whom you are writing to and what are the relevant information he would require. That's how you pick up the right content. For example, uh, let's say mm, you're writing to a person, um, to your friend. Let's take in general. We are not coming to OET. So when I'm saying about just an example, I would like to say you're writing to your friend, and you actually your friend sent you a letter or whatever asking you some questions about your holiday, or about asking about your holiday which you have gone 2 months back. Okay, so would that be appropriate if you write about uh, about your current situation to your friend? No, right? So the reader or your friend wants to know about what? Your vacation, which you have taken 2 months ago. So you should be writing about that. That is what it's all about. It's just a quick, simple example which I would like to share. Okay, I hope that would explain your question. Yeah. So, is there any word count? Yes. Is there any word count? Yes. As I've mentioned earlier, OET. Yes, there is a word count that is 180 to 200 words. So you should restrict your writing within that. Okay. So that is a word count. Yes. So any further questions? You're welcome, Murugan. Any of you have any questions? Okay, so I presume we don't have much questions coming up. I do see a few of you typing some questions. Yes, in between, I would also like to tell you that I think we have almost exceeded the prescribed time, which was 2 hours, and we have exceeded with 15 minutes. But it's absolutely fine. It's okay. I'm okay with that. All I wanted to say is that you will be intimated with a link today to your email addresses about the next session that is for tomorrow, or maybe you know the link will be sent to you today itself via mail. Okay, so please check out your mail so that you can get the links towards the next webinars which is going to be conducted on maybe on different modules. Okay, so any further questions? Thank you for the information. Thank you, sir. Thank you for these informations. You're all welcome, guys. And if you have any further questions, as I said, you may contact the number which I provided to you, so you could get further information about that. And I hope to see you all soon again in another webinar or so. Have a nice day. Thank you.